So today we have with us here Mulund's leading gynecologist, obstetrician and fertility specialist, Dr. Rita Mehra. Over to you, doctor.
Thank you, Neha, for the warm welcome. I'm ready to answer all your questions, whatever doubts you have, so we can give some knowledge to the people who are watching. Thank you so much.
Thank you for being present here today. So since we have you here, I have a lot of questions for you, questions about women's health, about men's reproductive health. So beginning with the first question, I just got a notification on my phone about the air quality index of Mumbai, and it seems to be very poor. So I wanted to know if the air quality or the environment, just the pollution and the kind of environment that we have around us, does it affect our fertility in any way?
Yes, it does. When the air quality is bad, is definitely meaning you are going to land, some of the patients may land up in infertility at a later date. It has been proved that the fertility gets affected by 20% with air pollutants.
Okay. So
in male also, the fertility, it can affect the sperm count and the motility. Also in the females, it can affect the egg reserve and the menstrual cycle.
right. So apart from maybe air pollution, are there any other pollutants that might also affect fertility?
The copper and the lead also can lead to decreased fertility.
Okay,
So one has
specifically
to-
copper and lead.
Lead.
So doctor, I've heard of IVF very commonly, but apart from like the full form of it, I don't think I know anything else about IVF. What exactly does happen in IVF?
In IVF, well, first and foremost, IVF stands for in vitro fertilization. What process takes place in our body naturally? This is done the entire thing in the lab. It's a wonderful progress that has taken place in science for infertile couples. So the first in IVF, the patient comes for counseling, and then we come to a diagnosis. What is the problem? Then we investigate the couple. The wife's blood tests are done, the AMH, anti-Mullerian hormone, prolactin, TSH, and all the health issues like diabetes, thyroid, blood pressure, semen examination of the husband, and of course the most important, the pelvic sonography of the wife.
All right.
After getting investigations done, we come to a conclusion what protocol we are going to follow. Then we start stimulating the ovaries. Once the ovaries are stimulated, the oocytes develop in both the ovaries. Once the oocytes have reached a perfect stage of 19 to 20 millimeter, we admit the patient for anesthesia, and after 4 hours she is discharged after retrieving the eggs. Once the eggs are retrieved from the ovaries under anesthesia, then at the same time the husband is given a special room, the semen room, where he gives a fresh sample of semen. And with this sample of the semen, each and every oocyte that we have retrieved, one egg is injected into each oocyte. And after this procedure, the oocytes which are injected with the sperms are placed in the incubators for fertilization. Every second, third day, we take out the slide from the incubator and see how many oocytes have got fertilized. On the fifth day, which is the right day when the blastocyst stage forms, those are the ones which are going to give a very good outcome of pregnancy once they are placed inside the uterine cavity. That is, the next step would be the embryo transfer. Initially, we used to do embryo transfer immediately, but now the funda is changed. It is that freeze all the eggs and transfer next month. The reason behind this can be explained very well. When we do in that very cycle, the eggs, the ovaries are too much stimulated, so the transfer may fail. If we wait for 15 days after the egg retrieval, the ovaries come back to the normal structure, size, shape, and the ovaries are no more hyperstimulated. The uterus and the endometrium is better prepared to accept the embryo.
Right. So doctor, correct me if I'm wrong. If I've understood it correctly, I think we retrieve the eggs from the female, from the male the sperms are taken, and then they are fertilized outside the human body.
In the
lab.
In the incubator.
Okay. And then once the fertilization is done, it's placed back inside the female.
That is, we can do it that very month itself.
Okay.
Or preferably now, the thing is, it is done in the next month.
Correct.
Because we freeze the oocyte, the embryos in liquid nitrogen as at minus 196 degrees centigrade. The embryos are frozen, and
Correct.
when next month we call the women on the third day of the menstrual cycle, we give her certain estrogen tablets which prepare the lining of the uterus to accept the embryo. We do our follicular studies and see which is the right time to transfer the embryo inside the uterine cavity. That we come to know on the sonography, and then we place we call them when the endometrial thickness is around 9 millimeter, we call the women for the transfer of the eggs. Mind you, anesthesia is only required at the time of pickup. It is not required at all at the time of embryo transfer. We call the patients for embryo transfer on full bladder, and under sonography control, we place the embryo into the fundus of the uterus and we shift the patient out. The patient rests for maximum 1 or 2 hours. After that, she can go home.
Right. I think this is a very intricate procedure. You need to check the thickness of the uterus lining, like you said, and then time it out accordingly. And you'd also mentioned that the eggs that are not used, you transfer it back, right? And you mentioned that there's a certain waiting period. Is there a reason for that?
The eggs, once we retrieve the eggs, the remaining eggs, the ovaries are already in a hyperstimulated stage. So that is not the right time to transfer the embryo.
Okay.
If we wait, the body gets chance to recover and come back to its normal. And that is the time patient also gets more mentally prepared. And once she gets her periods, after the ovum pickup, then on the third day you call her for a sonography.
Right.
See the lining of the uterus, help her with some tablets to improve the lining. And once the lining is around 9 millimeter, that is the day when the embryo transfer is done.
Okay.
And post-embryo transfer, we give them instructions and give certain detailed medicines which they have to take it properly. And of course, after 14 days, we call them for a blood test called the beta subunit of HCG to see whether the procedure has clicked and she's positive or negative pregnancy.
Okay. I think you very elaborately explained to me what IVF is. I would also want to know that is there any specific condition, कोई specific criteria है या कोई condition है जब IVF के लिए लोग opt करते हैं?
No woman or no girl, anybody would opt for IVF unless they have tried naturally.
Correct.
All the natural procedures, once they fail, then they go to the IVF specialist to find out what is the cause and then do it. Suppose we do everything for the patient like IUI, and we do, suppose they have got endometriosis, suppose they have got fibroids, we have treated everything. In spite of that, they are not conceiving, then we ask them to go for IVF. Now, the AMH is very important to determine the fertility. If the AMH is less than 0.8, the patients definitely land up in IVF. It's not that, but of course, miracles are seen. I've seen 2-3 patients with an AMH of 0.4, still they have conceived without IVF. Of course, these are miracles. Though science literature says that the AMH has to be 0.8 for a person to conceive naturally without IVF.
Could you tell me what AMH is?
Anti-Mullerian hormone.
Okay.
It is a hormone which tells you the reserve capacity in your body.
Okay, so how many eggs I have left in my body?
What is the reserve capacity left in your body?
All right, and the minimum criteria, like you said, has to be
0.8.
Okay, all right. So, doctor, you explained IVF beautifully and in a very elaborate manner. So, if you had to sum it up, अगर आपको 4 simple sentences में बताना हो कि IVF में क्या होता है exactly, so how would you say that?
Simple हिंदी लैंग्वेज में यही बता सकती हूँ कि एग्स औरत के बाहर निकाल लेते हैं, हस्बैंड अपने सीमेन सैंपल में से उनके स्पर्म्स ले लेते हैं, दोनों का मेल लेबोरेटरी में होता है इन द इंक्यूबेटर, जो चीज़ एक्चुअली नेचुरली हमारे बॉडी में होती है.
राइट.
फिर जब वो बच्चा बन जाता है तो फिर हम पेशेंट के बच्चेदानी में डाल के देते हैं विद द एम्ब्रियो कैथेटर.
Okay, so the process that actually happens inside the mother's body, वो हम बाहर recreate करवा रहे हैं in a lab,
correct.
which is very beautiful. Okay, तो IVF के अलावा क्या और कोई options है fertility के लिए?
Yes, it's a very inexpensive and a non-invasive technique. उसका नाम है IUI. IUI में क्या किया जाता है, पेशेंट को टैबलेट्स दी जाती है एंड इंजेक्शंस किसको टैबलेट्स तो कंपलसरी. फिर फॉलिकुलर स्टडीज़ करते हैं, स्टडी ऑफ द ग्रोथ ऑफ द एग अंडर सोनोग्राफी कंट्रोल. पेशेंट को हर तीसरे दिन बुलाया जाता है, सोनोग्राफी की जाती है. जब उसकी एग की साइज़ हो जाती 19 या 20 मिलीमीटर, तभी एक इंजेक्शन दिया जाता है ताकि अंडा कोश में से फूट के बाहर आए. मगर नेचुरली जो प्रोसेस हमारे पेट में होता है वो नहीं होने देते हैं. वो हम उसके अंडर प्रोसेस IUI के दिन, ओव्यूलेशन के दिन पेशेंट को हम बुलाते हैं और उसके हस्बैंड को एक सीमेन सैंपल देने को बोलते हैं. वो एंड्रोलॉजिस्ट लैब में सीमेन सैंपल को प्रोसेस करता है. उसे मोटाइल स्पर्म्स, अच्छे एक्टिव स्पर्म्स ऊपर तैरने लगते हैं. वो स्पर्म्स निकाल के IUI कैथेटर से पेशेंट को के यूट्रस में डाल देते हैं. It is done without anesthesia. It is absolutely painless. You have to master the technique, and the results are also very rewarding. At least 70% of my patients click with IUI, and those who do not click, then I suggest IVF.
I think the main difference that I could see is IVF में fertilization body के बाहर हो रही है and IUI में अंदर ही inject किया जा रहा है. So fertilization is happening in the body. I have also heard of another treatment. My relative was mentioning ICSI to me, but I don't know a lot about it. तो क्या आप उसके बारे में कुछ बता पाएंगे?
It is called ICSI, intracytoplasmic sperm injection. ये IUI से डिफरेंट इसके लिए होता है. ये एक तो एक्सपेंसिव है थोड़ा, एंड इट्स वेरी स्पेशलाइज्ड प्रोसीजर. इस प्रोसीजर में जब एग्स औरत के अंडर एनेस्थीसिया निकाल लेते हैं, हम स्पर्म्स उसके बाजू में, एग्स के बाजू में छोड़ के नेचुरल फर्टिलाइजेशन होने दे सकते हैं. मगर अगर हमको रिजल्ट मोर बेटर चाहिए, रिजल्ट ज़्यादा अच्छा पॉजिटिव मिले, इसमें हम लोग एक एक स्पर्म लेके ओलंपस माइक्रोस्कोप के जरिए एक एक स्पर्म को एग के अंदर डाल के इंजेक्ट करने के बाद इंक्यूबेटर में प्लेस करते हैं. सो द चांसेस ऑफ फर्टिलाइजेशन आर मोर एंड द रिजल्ट के चांसेस बढ़ जाते हैं. It is called ICSI. It is recommended in male patients who have very severe oligospermia, जिनकी स्पर्म काउंट बहुत लो होती है. उनके लिए ये आइडियल प्रोसीजर है.
करेक्ट. सो ये मैन्युअली जो है वो स्पर्म को प्लेस किया जाता है थ्रू द ओलंपस माइक्रोस्कोप दैट यू सेड.
एक एक स्पर्म को लेके बट एक एक एग के अंदर इंजेक्ट कर देते हैं.
करेक्ट. सो आई एम गेसिंग ये माइक्रोस्कोप से बहुत ही ज़्यादा जूम इन किया हुआ व्यू मिलता होगा, अदरवाइज इट्स अ वेरी इंट्रिकेट
It's very intricate procedure.
Right. So now we have the good news that the patient is pregnant and they're expecting a baby. So what are some things that the to-be mother, the expecting mother, can do to care for themselves?
The entire care in the pregnancy is divided into 3 parts. The first trimester, the second trimester, and the third trimester. In the first trimester, when the patient visits the doctor, a sonography is done to confirm the date of the delivery, to see there is a single pregnancy or a twin pregnancy, and the most important also to see whether the pregnancy is inside the uterus or outside the uterus. Next step is the blood test of the woman to see whether she's suffering from some thyroid problem, diabetes, hypertension, or asthma, or any heart related problems. If all these are detected in the early stages, the pregnancy will be smooth sailing for the woman. Even before the complications occur, one can deal with them even before any complication comes.
So now coming back to, caring for mothers who are to-be mothers. So when would you say it's the right time to, visit your doctor?
It's a very important question you have asked. Any woman who sees on the urine pregnancy test the 2 lines, the first thought is, when should I visit the doctor? It is very important that the woman visits the doctor in the initial stage itself, because it helps her in multiple ways. One, to know where the pregnancy is. One, to know the date of the pregnancy. Her health checkup will be done, like regarding the blood pressure, diabetes, thyroid. Then she gets a lot of emotional support from the doctor. She can know the do's and don'ts in pregnancy, what has to be done. She can be guided by the doctor at every step. So it is very important to visit as soon as you come to know.
All right. So without wasting any time, I think it's important to see your doctor. All right. I think another question that this brings me to is pregnancy is celebrated very largely in India. And, everyone in the house is taking care of the pregnant mother. They're not letting her lift things and, helping her around. So what are some things that a pregnant mother should not do? Like, is it important that she does not carry weight or exercise during pregnancy?
I would say she should be active. But active doesn't mean that she should lift a bucket of water or she does mopping the floor. All those things are not recommended. She should carry on with her routine activities, because that helps to supply proper blood to the organs and it helps in normal delivery.
Okay, so it's safe to do a little work around
Yes,
the house, but
definitely,
not lift
definitely,
a lot
not
of
lift.
weight. So, doctor, as we get closer to the due date when the baby is to be delivered, is there something that we need to keep in mind that mothers need to, take care of or talk to their doctors about?
It's very important. These checkups should be done right from the beginning. In the first trimester of the pregnancy, we do the first dating sonography. Then we very important to do the NT scan, nuchal translucency test, and the dual marker blood test. After that, in the second trimester, we do the anomaly scan on sonography to pick up any abnormality in the organs of the baby. After that, we do the growth scan to see the amount of LICA that the baby is floating in is correct or insufficient. And then the vaccinations are given to the pregnant woman. The three vaccinations that are given is the Fluvac for flu, then Boosterix vaccination. It is for diphtheria, pertussis, and tetanus. And the last is the plain TT. All these three vaccinations have to be given in the second trimester. In the last trimester, she has to be asked to do yoga, exercise in the second and trimester, and she has to go for regular walks, breathing in the open air properly, and she has to go for a color Doppler in the last stage to see the blood supply to the baby is proper till the end, and there are no loops of cord on the neck of the baby.
And there's also another thing that I've heard that, certain exercises or certain type of yoga before delivering the baby are also helpful in
They are
this.
definitely helpful. We have kept yoga classes in our hospital. We have also the yoga teacher regularly visiting the patients. And if those people who cannot come, they can easily avail of a facility even online.
Okay, so exercise does play a very
A
important
very important role.
Okay, so doctor, PCOS and endometriosis, these are two common terms that I've personally come across, and I've heard that they affect fertility. So I wanted to know what kind of effect do they have on chances of fertility?
Yeah, it's a very important question. PCOD is polycystic ovarian disease. It is a condition where, because of bad lifestyle, this thing is seen. During my days of medical college, we had a chapter of PCOD was only 5 lines. Today, the chapter of PCOD runs in 200 pages. It is a condition. It's a condition of the bad lifestyle of the prevalent, which is prevailing now. In the women have to do a regular exercise and diet control, not to all the time eat junk food in the offices. Healthy food is very important to preserve the fertility. In PCOS, the male hormone increases in the body, and that leads to cyst formation in the ovary, and that leads to polycystic ovary. That in turn leads to infertility and obesity and heart attacks. Chances increase.
Okay, it can also lead to heart attacks.
Obesity, because it leads to obesity. Because of the obesity, naturally the cholesterol increases and the chances of attacks are more in later age.
Correct. And could you also tell me a little more about endometriosis?
Yeah. Endometriosis is a condition where the inner lining of the uterus, called the endometrium, starts growing outside the uterine cavity in places like the fallopian tube, in the wall of the uterus, on the ovaries, on the inner lining of the pelvis. This causes severe menorrhagia, which means heavy menstrual bleeding, very painful menses called dysmenorrhea, and it can lead to dyspareunia also. It can also affect the menstruation can make it very irregular and very heavy. The conditions where it occurs, I've told you, the cause of it is not yet confirmed. Many people have put a lot of theories, like the immunological theory, the genetic theory, and the hormonal imbalance, but nothing is finalized. But mind you, endometriosis is a very horrible condition.
Right. And do we have any sort of treatment options for both of these?
We have definitely. If the endometriosis is very bad and widespread, the patient definitely requires operative line of treatment with a laparoscope, remove the chocolate cyst in the ovary, and then you can put on follow-up therapy by giving injections which suppress the lining. The main thing is because the endometrium lining sort of structure tissue is there outside the uterus, which is growing and causing this problem. After the surgery, you can put the patient on medical injections also. Monthly injections are available, 3 monthly injections are available, even tablets are available to keep the tissues in a suppressed condition and so that they do not trouble the patient.
All right. And is it possible to treat PCOD as well?
Yeah, a lot of medical treatments have come which to treat the PCOD. But the most important is exercise, diet, walking, swimming, skipping. These are the most important things I would recommend. And not to eat junk food all the time. Once in a month, it's fine, no problem.
So I think PCOD treatment is more towards lifestyle changes.
Yes, 100%.
Okay. And this brings me to another question. So cervical cancer is something that has been talked about a lot recently. And could you shed some light on that? And are there any vaccines or any treatment options that are there for this?
Yes, definitely. Cervical cancer is one of the most prevalent cancers among the women. It can be easily treated if diagnosed in time. A lot of screening procedures are available, but I think very few women avail all those facilities. Of things are like pap smear, every yearly can be done. Then the human papilloma virus test can be done. Then the colposcopy can be done. All these 3 screening procedures ideally should be done on all women every year, once in a year, from the age of 21 to 65. If these procedures are followed, the cancers can be picked up at an early stage. Yeah, there are a lot of vaccinations which have come to treat the cervical cancer. All these vaccinations can be given to girls right from the age of 11 to 12 to till the age of 26. The vaccinations can be also offered to women after the age of 26. But how much will they benefit? It depends upon already how many risk factors they are already having. But we definitely recommend to all girls and women. There are 3 vaccinations that are available now. Initially, only the Cervarix was available, which was given in 0 month, 1 month, and 6 months after the first dose. Now, we have Gardasil vaccination, which is a very good vaccination that is from Britain. And this vaccination, there are 2 types available. One vaccination against 4 virus and one vaccination against 9 virus. And now India has come out with a vaccination made in India itself for the cervical cancer called Cervarix.
Okay. So apart from this, are there any certain risk factors that make a person more susceptible to developing cervical cancer?
It is 100% confirmed that the women who have multiple sexual partners and who have sexual transmitted disease, they are the ones who are more prone to cervical cancer.
Okay.
Today itself, one girl has come today to the hospital.
Okay.
She's developed all this.
All right. And does genetics or
Genetic
hereditary
also
play a
hereditary
role?
can work, but it is more 100% more is the ladies who have multiple sexual partners and who involved in sexual activity at a young age are the ones who are more chances of cervical cancer.
Okay. So, doctor, counseling is something which is commonly recommended for couples who are facing reproductive challenges. So, how helpful is counseling?
It's a very, very helpful thing. Every IVF center should have a counselor also in the premises. It's very important because infertility is not only a physical issue, it's also equally an emotional issue. The counselor can counsel the patient properly, take away their stress, and can form better communication between the partners and come to an informed decision regarding what procedure finally they are going to opt for and what they should opt for, so to achieve their goal of parenthood.
Right. So, I think mental wellness is equally important when it comes
It's very,
to...
very important today in stressful life.
So, doctor, now I have like a few questions about fertility and reproductive health. So, I'll just ask you those one by one. These are a few common statements I've heard people around me say. I've heard my friends and my family mention it. So, could you let me know whether it's true or whether it's false? Whether it's a myth or whether it's actually the reality? So, I'll just begin asking you the first one. So, I've heard that eating pineapple helps boost fertility.
It's a myth.
Okay, so it doesn't actually do
Listen
that.
to that.
And there's another thing I've heard, that sleeping in certain positions gives you more chances of pregnancy. Is that true?
It's again a myth. It's only that you have to lie down for 20 minutes after that person. That's it.
Okay. Women cannot get pregnant after 35.
It's totally a myth, because we have this in artificial reproductive technologies, where I have got now patients who are age 44, they all have conceived with IVF.
Okay. So the next one, fertility is always a woman's issue.
Never. It can be also a men's issue.
Ovulation can occur mid-cycle.
In a PCOD patient, the ovulation never occurs mid-cycle. It is totally wrong.
Okay.
It is in a person who is menstruating regularly that it occurs mid-cycle.
Okay. So the next one, men don't experience decline in fertility.
It is wrong.
Okay, so
It
it's
is
false. Okay. If you have irregular periods, you're automatically fertile and you can't get pregnant if you have irregular periods.
It's wrong.
So you can get pregnant even if your cycle is not very regular.
Yes.
Okay. You should lie down after sex to increase your chances of pregnancy.
Maximum 20 minutes.
So it is true, you need to
Yes.
lie down. Okay. So the last one now. Once you have a baby, it's easy to conceive again anytime.
Not necessary. After the first delivery, she may have developed some infections of the uterus or the fallopian tube, which will prevent conception.
Okay, so it's not always easy.
Not always.
Okay. So doctor, there are a lot of misconceptions around menstrual health. मैंने कई बार सुना है कि women who are menstruating are not clean enough, or like they're dirty, they can't go to certain places. There are a lot of restrictions. So are there any misconceptions like these that you've commonly heard from patients that come to you that you'd like to clear up?
Yes, it is a very important thing which you have said. Many women come and say that their mother-in-laws do not allow them to enter the kitchen because they're menstruating and not allowed to cook during those days. So this is a very wrong thing. Correct information has to be given to the women so that they understand menstruation is not something which is wrong. It is a sign of a healthy reproductive function in the body.
Right.
This can be imparted to them through information given to everybody via the media, or when the patient comes to you for counseling, or having some scams where people are given knowledge about all this thing. Menstruation is a very healthy sign, and this concept should be removed.
So when we talk about menstrual health, are there some things that we can keep in mind for menstrual hygiene, to maintain good menstrual hygiene?
The women, I think there was a movie on this. So this is especially for the rural people, where they have to use the pads and nothing else, and it should be changed very frequently. It's very important, and the pads also have to be discarded properly. That's it.
Okay, so doctor, we've spoken about IVF and a lot of other topics. Usually it is not very well spoken about. And do you see a change in the attitude of patients that come to you now for IVF or other fertility treatment options? Is there more open dialogue now? Have their mindsets shifted in any way according to you?
Yes. In 1982, when I started my practice, people used to come and tell me, is it natural? Is it real? Or is it was a very controversial topic. It was not accepted at all. But now we have people walking into our Mehra IVF center and demanding for IVF. So you can see the drastic change has taken place. This could be attributed to a increase in the technology, advancement in science, and the outcomes have improved terribly, which is a very good point for the patient. So that's why the acceptance is more.
Right. So people are more aware now of the options
That are available for them.
So thank you for answering all the questions here today. And before we close, with the experience that you have, 30 years of experience in this field, what is one message that you'd like to give to all the girls, all the women who are viewing you today and listening to you?
I think it's very important that the taboo of not talking about menstruation, pregnancy, infertility, which is still existing among many people, this should not exist anymore. The girls and the young women should freely discuss with their family members, and if they have any difficulty, they can visit a nearby doctor immediately, so that all the myths can be easily resolved. Or if they really have some physical problem, that can be dealt with properly by the nearby doctor. I would advise that everybody should seek early advice and do not hesitate. We doctors are not meant here to judge you, but just to give you the right guidance. So please do not hesitate to go to the doctors, and you can always also discuss with your family members.